Hello, my name is Christian Hackenberger. I'm a chemist and I'm working at the Leibniz Forschungsinstitut für molekulare Pharmakologie in Berlin. I'm also a professor for chemical biology at the Humboldt University zu Berlin. But most importantly for today, I'm a Falling Walls finalist. Well, I was in bed. I was 13 years old. But I still remember very clearly how my mom came running into my bedroom with some very exciting news. And then I joined her. We went to the living room where the TV was, and there we saw all the people dancing on the Berlin Wall, which was very emotional for us because we had a lot of family members in the former DDR. Well, first I wanted to become the next Boris Becker and then also a famous piano player. But both my tennis coach and my piano teacher did not really like that idea. And so I took up some inspiration from my family. We have a long tradition, a lot of family members. My parents worked in the chemistry industry. And then I decided to become a scientist, a chemist. And I should say that I'm not only doing research, but I also educate and I teach the next generation of scientists. And this is the best thing that could ever happen and a dream really coming true. Well, we want to break the wall to find new therapeutics against cancer and viral infection. And I think the challenge is pretty obvious. We experience this right now in the corona pandemic. We desperately need new therapeutic possibilities for treating these life-threatening diseases. And our solution is very simple. We want to take the best out of the world of biology and chemistry, and we want to combine it together to pretty much come up with a new way of treatment. And how this is going to work, I'm going to explain in the next question. Well, we use chemistry in order to make chemotherapy a lot better tolerated for cancer patients. How do we do this? We take a toxic molecule and chemically load it on a biological molecule, an antibody. And the antibody is the one that is then responsible for carrying this toxic molecule only to the site where it is needed, to the tumor cell. Imagine a scenario, a picture. In order to illustrate this antibody is a sniffing dog or a small robot, and the toxic molecule is a bomb. So this robot would carry then the bomb only to the site of action, to the tumor, and leads to a specific irradiation only of the tumor cell. And of course, that's great news for the cancer patient because it means chemotherapy is a lot better tolerated. And exactly the same kind of concept of combining chemistry with biology we're using to prevent viral infection. Here we are not inventing a new type of bomb, but a superglue. And this superglue we make by taking now a viral capsid, which occurs actually in our gut. And we decorate it with entities that then bind towards a lethal virus. And this works great to inhibit the influenza virus. We are working currently very hard to translate this to the coronavirus. So we are fighting one virus with another virus. I think you heard we are developing new therapeutics that are better tolerated. I think it's pretty obvious. This is great for society and for different patients. Well, so far we've demonstrated that our system works in preclinical studies, and we have to demonstrate that this works also further in patients. We recently raised a lot of money as part of a small company that we founded named Tubulus, so we are very eager to demonstrate this further. And which part of your research keeps you lying awake at night? Well, fortunately I have a very solid sleep unless our cats wake me up. So I rather get up excited in the morning, and the most daunting question right now is transforming this superglue, virus superglue idea to the coronavirus. Well, I have a lot of friends which are outside chemistry, so their reaction can be separated usually in 3 phases. Phase 1 is, oh no, not chemistry. Phase 2 is, I don't understand a word. And then phase 3 is actually, oh, this sounds pretty cool. You can fight a virus with a virus. I want to learn more about it, and this is what we should have learned in school.